All right. So, very good evening to everyone who's joined in today with us. Welcome back to another Power Packed session of Wellness Wednesday. This is Abhishek, your host, and with me today, I have a very amazing guest, uh, who is a doctor. We have Dr. Ameya Kanakiya from Mumbai, who will be speaking to us today. Today's session is gonna be really overwhelming. A lot of new experiences, a lot of new learnings, and it is oriented a lot towards women health. So, based on our previous sessions and the feedbacks that we've received from all of you, it was a great opportunity for us to have Dr. Ameya come and speak to us about our today's topic. And before we begin, a quick reminder again to all of you to please have a glass of water, stay hydrated, because we're going to be learning a lot. And I want you all to be super energized as we have our team from Elda Health today taking over the webinar. So, Elda Health is a organization that was founded by Dr. Ameya Kanakiya here. Doctor has over 15 years of experience in guiding women with a combined approach of both medical interventions and lifestyle management. So coming from a great background like this, I think it's an amazing opportunity for us to understand how our lifestyle and our value systems and how we actually function on a daily basis can affect and influence our health in a lot of ways. And today's session is gonna be about menopause, and it's gonna be an entire journey understanding from puberty to late adulthood. It's an open session for all of you. So in case you have anyone around in your house who is not doing anything, please pull them and make them sit with you and attend this session, because today's session is going to be great. We're going to learn about PCOS, pre-pregnancy care, prenatal care, infertility issues, post-pregnancy, postpartum depression, a lot of things. So it's going to be an exciting event, and really looking forward to Dr. Ameya giving us a lot of insights today. And thank you so much for taking out time and joining us today. We'll have a 15-minute Q&A session for everyone who's attending. Please note, we'll have a 15-minute Q&A session towards the end. So make sure you pay attention, ask your questions, put them on the chat box, and interact with Dr. Ameya. Over to you, Doctor.
Thank you so much, Abhishek. That was such a lovely and such an energetic introduction to today's session. So even I'm energized. I also have my glass of water next to me,
Yes.
and yes, and I'm really happy, excited to be talking to you all about this. And yes, let's get started because I'm going to cover a lot of topics. So I don't want to be short of time in answering your questions also. So yes, that's me. And going to the first slide, so it's a gynecologist talking about women's health, so it has to begin from periods and how periods are, what periods are, the basics about your menstrual cycle. So typically, when we describe a menstrual cycle, we begin from periods. So the first day of your periods is typically the first day of the cycle that we want to talk about. So the moment you start having periods, that is the first day of your periods, around that time, the ovaries, that is those white structures next to the uterus, they start their process of development of eggs. So there's a cohort, a group of some 8 to 10 eggs that start developing, and at the same time, the uterine lining, that lining inside the uterus, is getting prepared in anticipation of a pregnancy. So that's going on in the first half of the cycle. The mid cycle is marked by what we call as ovulation. So out of those 8 to 10 eggs which have been developing, there's a race between all of them. One of those wins the race. It goes ahead, it becomes bigger, it ovulates, and it comes out of that ovary. It's caught by those fallopian tubes, it goes inside the tubes. Around this time, if you have intercourse, it may result in a pregnancy. The uterine lining is already prepared to host that future pregnancy, and that pregnancy comes inside the uterus. In case there is no pregnancy, there is a complex that is formed in the ovary whenever there is ovulation. So that complex, which we call as a corpus luteum, it has a life of 14 days. So after 14 days, it degenerates, the hormone levels fall, your estrogen levels fall, your progesterone levels fall, and these are the hormones that have been maintaining that lining inside the uterus with the fall in the levels of these hormones, the uterine lining also sheds off, and that is what is periods. And we come back in the cycle, back to your periods, only for this to start all over again. So this is the basic menstrual cycle, and based on this menstrual cycle, I'm going to go to the first topic we are going to discuss today, which is PCOD, and it's an extremely common thing these days. It's, I mean, 1 in 5 women are having PCOD. It's become extremely fear. People are really fearful of, oh my God, I have PCOD. So let's kind of understand what this PCOD basically is. So the incidence of PCOD definitely has increased over the last few decades, and why we don't really know, but it's the incidence is around some 23 to 25%. It typically happens in the age group between 18 to 45 years of age, and yes, the incidence has been increasing, and the increasing incidence is attributed to certain things like environmental factors, the kind of food we eat, the kind of adulteration that we have in the food we eat, the kind of pollution that we are faced, the sedentary lives that we are leading these days, the lack of good nutrition. Also, there is some heredity involved. So if your elder sister, if your mother has been having PCOD, that's one way, that's one reason why you can also land up with PCOD. Now, understanding, we can go to the next slide, Gopika. So to understand what PCOD is, basically the basic pathology of PCOD basically is that there is no ovulation. So if you go back and think of that cycle that we spoke of, periods हो गए, उसके बाद the eggs start developing. I said 8 to 10 eggs start developing. There's a race, one of them wins. PCOD में there's a draw. No egg becomes big, no egg ovulates, and that is why these eggs kind of get arranged around the ovaries, giving it kind of a necklace appearance, which is seen on sonography pictures. So the basis behind, the pathological basis behind polycystic ovarian syndrome or polycystic ovarian disease is that there is no ovulation. Because there is no ovulation, the rest of the cycle, which happens after ovulation, does not happen. But the uterine lining has started developing inside the uterus. So it keeps on developing. That cycle is not happening. Ultimately, it comes to a point where it becomes so thick that it has to shed itself off. That is why you don't have periods after every 1 month that you typically do, but you have periods maybe after 2 or 3 months. So that is the basic thing that happens in PCOD, that there is a hormonal imbalance. Now, along with that, there's a lot of other hormonal changes happening at inside your body at that micro level. There is insulin resistance, your male hormones are increasing, so there could be instances where you have increased facial hair, increased hair on the body, a male pattern type of balding. So all of these are the symptoms that happen along with PCOD. Typically, women come and say that, I did not get my periods, and so I have gained weight, or I have PCOD, so I have gained weight. Very often it is exactly the opposite. You gain weight, and that is why you don't have periods. That you gain weight, that is why you get into that cycle of PCOD often. And why the way you gain that weight is important. That the way you gain weight is by lack of exercise, wrong eating habits, all of this leading to a lot of hormonal changes inside your body, which lead to weight gain, which cause inflammation, and which also results further in your PCOD. So this is why PCOD happens. Next slide. So now once we know that why it happens, let's come to find out how do you diagnose it? How do we diagnose? How do we doctors diagnose it? So you need to have 2 out of these 3 pointers. You either need to have irregular periods, because again, no ovulation, no periods, or irregular periods. Then signs of some male hormone excess, which means increased facial hair, your male pattern balding, increased hair on your body. All of these are, or acne, all of these are signs of male hormone excess. Third thing is something that you see on your sonography. So you see ovaries with those eggs studded on the outside, and that is again indicative or suggestive of PCOD. Now, just because you have a sonography which shows PCOD like picture doesn't mean you have PCOD. Remember, it has to be at least 2 out of these 3 things which will mean that you have PCOD. So that is how you diagnose PCOD. Okay, diagnosis ho gaya, periods nahi aa rahe, we have done that. Now what next? Next slide, Gopika. So when the next, before going to the management or the treatment of PCOD, let's see what actually happens on the symptoms and the effects of PCOD. So we saw some of the symptoms. We saw there are irregular periods, and there is acne, there is increased facial hair. We've seen all of this. Now there is something more which happens when you have PCOD, which is happening inside your body, which probably you can't see much on the outer side. So one thing is a development of this what we call as metabolic syndrome. Metabolic syndrome is a combination of high blood pressure, high uric acid levels, then increased cholesterol levels, increased waist circumference changes, or increased BMI. So all of this is a part. All of these are parts of metabolic syndrome, which slowly starts happening on the in the inside of your body. There is insulin resistance, again a part of metabolic syndrome. So what is insulin resistance? Basically, your body is secreting insulin, but it is not able to break down or digest the sugars that you are eating. So what does the body do? Body secretes more insulin, but it's still not able to digest the sugars at a normal level that it should. So there is insulin resistance, which typically is present on the muscular level. So of course, with increased insulin resistance, there is increased risk of diabetes in women who have PCOD for a long duration. And the third, another thing that we have because of this increased risk of diabetes, increased insulin is increased risk of diabetes. Because of increased estrogen levels that are there in the body because of PCOD, on a very long term basis, you might have increased chances of suffering from uterine or endometrial cancer. Having PCOD for 5 years is not going to end up in endometrial cancer. Having PCOD for your lifetime, not treating PCOD for your lifetime may result in endometrial cancer at the end of your life, about 50 years of age. So don't get scared. Next slide. So after that, how do you manage PCOD? So I spoke about, weight gain and wrong eating habits and lack of exercise leading to PCOD. So obviously the management lies in that. Management lies in controlling these things. So certain lifestyle modifications are going to help us to manage your PCOD. Now, when I typically talk about lifestyle modifications, I talk about 4 typical pillars that are the pillars of your lifestyle. So one is your diet, second is your exercise, third is your sleep, and fourth is your stress. So food, yes. So eating better, eating lesser packaged foods, eating lesser simple carbohydrates, less of sugars, more of whole grains, adequate amount of fats, lots of vegetables, lots of good vitamins and minerals is definitely going to help you. Exercise is something that typically girls or women ignore, at around the age of at a young age, in your 20s or so, unless and until you actually see that, oh my god, now my weight has increased, now I'll join the gym. It's rather better to have this as a lifestyle right from the beginning, that you routinely engage in some form of exercise, which is going to definitely help you in the long run. Exercise has so many positive effects that one whole webinar can go in discussing the good effects of exercise, really. So exercise definitely helps you to decrease your insulin resistance, decrease your weight. Even a 10% loss in your weight is results in changes or shows changes in your PCOD. Of course, even it's easy to say even 10% is definitely difficult to achieve that 10%, and I get you, but yes, we can definitely try for that. Then talking about the third part, which is very often ignored, sleep. Lots of these young girls and women who have PCOD, they sleep at 1 o'clock, get up at maybe 9 o'clock, or at times sleep at 1 o'clock, 2 o'clock, get up at 6 o'clock, 7 o'clock, because they have to go to office or go to their colleges or whatever. Adequate amount of sleep is really important for your body to recover from the day's insults or the day's exertion. You may be young, you may not feel the effects of less sleep, but yes, all of those effects keep piling up inside your body and manifest later. So it's definitely important to have a good amount of sleep and also a good quality of sleep. When I talk of quality of sleep, it means that sound sleep. You're not getting up again and again. You have not watched your Netflix series or your Prime series before going to sleep. So your phone is off for the last 1 hour at least before you go to sleep. You're not looking at your Insta before you go to sleep. You finished all of that at least an hour before you go to sleep. and you are dimming the lights, going to sleep in a good frame of mind where your mind and body are both relaxed. So
I
that is
think
what
this lifestyle change will take probably a generation.
I hope not. I hope not. I keep drilling everyone who comes to me. So I hope not.
Absolutely.
Yeah. And the fourth thing is, stress. So de-stressing is really important. You may not feel the effects of stress right now, but you may feel them 10 years later. So it's good to be prepared to handle the stress and to deal with the stress right away. So, de-stressing can be spending time with yourself, exercising, indulging in some hobby that you have. If you don't have a hobby, try a new hobby, inculcate a new hobby. All of this stress levels are not good for your PCOD. Stress means increased stress hormones, and these stress hormones means insulin resistance. It kind of goes on and on in a cycle. So it's equally important to de-stress along with eating a good diet, along with exercising regularly. Uh, next slide, yeah. So then we come to pre-pregnancy care. So both in relation with PCOD and otherwise. Very often I'm asked this question, what's the right time to get pregnant and what is the biologically correct time to get pregnant? To be really honest, in today's world, your biological clock and your career clock may or may not match. And I think we all have to accept that fact. Biologically you may have great chances of getting pregnant when you're 20, but probably you can't get pregnant when you're 20 because that's not the time which is suitable for you, for your lifestyle and for your career. So we have to come to a practical point where we can actually think of pregnancy. So there is, to be very honest, there is no right time to get pregnant considering all of these things, but you have to find the best possible time that you can think of, or you can come to when you're planning a pregnancy. uh, Coming to the second point is a fertile period. So we saw the menstrual cycle. So we saw that mid of the cycle was ovulation. So when you ovulate, that's the time when you can get pregnant. So in case you're trying to get pregnant, having intercourse around 3 to 4 days around that time of ovulation, because bodies never work like clocks. So you may not ovulate right on the 14th day. You might ovulate on the 13th day or the 17th day or the 12th day. So 3 to 4 days, 5 days around your mid of the cycle is a time which is a fertile period, which is good for you to get pregnant. When do you seek help? When do you've been trying for pregnancy? So when do you decide that, oh, now this is the time, I've tried enough and now I need to go and see my doctor? So typically we define infertility or inability to conceive, inability to get pregnant as 12 months of regular unprotected intercourse. If you've been staying with your husband, you've been trying for a year and you have not been able to get pregnant, good time to see your doctor to find out what is wrong, why is it not resulting in a pregnancy. Suppose you are maybe 30, 35 years and older, you can cut down this 12 months period to maybe 6 or 8 months. It's good to understand what's wrong earlier in case your age is slightly on the higher side. So that's about pre-pregnancy care. What kind of pre-pregnancy care otherwise you should take is again the same thing, those same lifestyle modifications that are there for PCOD. Whether you have PCOD or not, it's good to have a good weight before you get pregnant. It's good to eat well before you get pregnant. It's good to have an exercise routine before you get pregnant. It's good to sleep well. It's good to de-stress. All of these things are good to do before you get pregnant. Certain blood levels that you have to check for, well, just your hemoglobin maybe and your thyroid levels. If that is okay, you're good to go, you're good to get pregnant. Now when we talk about infertility, next slide. When we talk about infertility, it's PCOD obviously is one reason for infertility because you're not ovulating properly in when you have PCOD. But you have to understand that it's not just PCOD obviously which causes infertility. In fact, when you look at the causes of infertility, males and females can have an equal contribution when in case you're not able to get pregnant. So females could have problems like not ovulating properly. There could be some other conditions like endometriosis. There could be some polyps inside the uterus, some fibroids which change the anatomy of your reproductive system. All of these hormonal issues could be there. So all of these could be the reasons why a female could have for not getting pregnant. Talking about the male partner, there could be a low sperm count, there could be low motility in the sperms, there could be there could be some problem in the sperms, even though the count is good and the motility is good, which we call as a abnormal DNA fragmentation index, which can definitely be checked by a simple test. And of course, there could be some kind of hormonal issues. At the same time, there could be absolutely no reason for you to not get pregnant. Everything is all right, but you're not getting pregnant. The reason probably lies somewhere on a molecular level, which is not possible for us to diagnose at this point in time. But yes, there are certain times when everything is normal, yet pregnancy eludes you, and that's a time when some simple methods or simple solutions from your gynec can help you to get pregnant. Now, next slide. So, you have kind of come over all of these things and you've found out the perfect time to get pregnant. You've solved your infertility issues and you've gotten pregnant. You have delivered this some beautiful bundle of joy that you can see in this, something similar to this in picture, right? Um, Going to the next slide. So, you've just delivered your baby and, the world says, oh my God, she's so lucky that, the baby is so cute and blah, blah, blah. But you need to ask a question to yourself. Are you happy? Is it also happy for you? Because postpartum depression is for real. It's been there since ages, but it's only today or in the last few years that we have actually started recognizing it. It is not uncommon for you to feel unhappy, because even after you have had a child, even if everybody is pointing at you and saying, why should you be unhappy? You have such a cute baby. You were so lucky you got pregnant. That does not mean that you have to be happy. It's not compulsory. There could be problems in you feeling happy about this happy incident in your life. It so happens that we often see these such patients who come and say that, yes, I mean, and very few of them actually come and say this to us, but whomsoever do, whomsoever recognizes that yes, there is a problem, they come and say, yes, doctor, I understand that I should be happy. Everybody comes and says, why are you not happy? But I don't know what's wrong with me. I'm not happy. I don't feel happy. I feel sad all the time. It can go on to having thoughts about harming your child, which is what we call as postpartum psychosis. And this is for real. This can happen. This can happen to anybody. And it's not wrong if that is happening to you. It is just that you need to get it treated.
I think this is so well pointed out by you, doctor. And I think this is where, in all our webinars, we wait for a moment where our speaker is actually trying to, break a taboo and bring it out in public. That it's so important to treat these things as normal. It's okay if you feel depressed. It's
Yes.
okay if you feel unhappy. It's okay if you do not get validated your emotions after you start feeling unhappy, even after a baby. And I think that's so brilliantly put out by you. And I think a lot of doctors in India today need to hear this or understand this, so that more and more people can be aware of it. And people who are actually conceiving a baby next or anytime are aware of such a thing, and they do not take a wrong step for themselves
Right.
or their child. So I think
Or
that's
the
really
child.
important point.
When we talk about preparing for pregnancy, everyone speaks about all these other things. Thyroid check karo, hemoglobin check karo, folic acid le lo. But this is something which people don't speak about. Don't so unless and until you are aware that something like this can happen and there is a solution available for this, it is really difficult for anybody to go and seek
Right.
solution for that. Because typically you go and tell this to your family members, they're going to say, oh no, it'll be all right. But
Correct.
sometimes it's not all right. Sometimes it needs medication, and it's totally okay to take that medication. And because having a child can be really overwhelming, till you're pregnant, it's everything is about you. The whole attention is to you, and suddenly the attention goes to the child, and you are overwhelmed because you are the sole caretaker of the child, and you have to, you know, you're responsible for the child, and sometimes that responsibility can be overwhelming. And yes, we do need to understand that this can happen. So going to the next slide. So when we talk about pregnancy, again, we have lots of myths all over India, or I think maybe all over the world also, where pregnancy and eating is concerned. Ye nahi khana hai, wo nahi khana hai. A lot of things are there. Punjabis will think differently, and people from Orissa will think differently. People from
Right.
Maharashtra will think differently. People from Karnataka will think differently. And yes, I mean, we get patients, and now especially when, funnily enough, when inter what do you say inter
Intercaste.
caste marriages and all are common. It's very funny, sometimes, when Punjabi mother-in-law is saying, coming and saying, "Arey pronti nahi khati," and somebody in Maharashtra is coming and saying that, "Arey, she should eat only bhakri, why is she eating all of these prontis with lot of so much of ghee?"
Right.
So, there could be a lot of confusion here. So, just to break the confusion, you can eat everything after your pregnancy. You don't need to avoid um, typically avoided things. You don't need to avoid sprouts. You don't need to avoid potatoes. You don't need to have too much of ghee. You don't need to, eat only very mild and food without any spices. You can eat everything. Everything in moderation is good, and everything in moderation is required for your body. You can't really live with just eating, I don't know, that turia, or not just eating that bhakri and just eating bhakri and milk. That's not done, because you're depriving your body of essential nutrients in this time.
I am
And
craving turia right now. I'm really sorry.
really, oh my god, okay. I took it as a bad example. You don't have to eat today, you can eat everything. So what you actually, I mean, imagine your body has created one human being. The human being is out of your body. You're producing milk for the human being. Your body definitely needs everything, right from your dahi to your potatoes to your brinjals to your pulses, everything, of course, in moderation. Like, every person is different, every baby is different, so your baby may not respond well to a certain food item that you have eaten, and in case you do, you can simply stop having that or reduce having that item. So yes, you can eat everything after you have gotten pregnant. Secondly, again, breastfeeding in itself is something which is going to be burning calories. So when you're sitting on breastfeeding, yes, you're burning calories. But at the same time, you definitely do need to exercise after your pregnancy. The time can vary. If you typically after normal delivery, you can wait for a month or so. If it's a C-section, wait for 3 months or so. Of course, the time can depend and change depending on the type of delivery you have had. So please take your gynec advice before you start exercising. But yes, you definitely do need to exercise. Start exercise whenever you can. And it's good to exercise overall, but it's also good to do some core strengthening exercises, excuse me, because your abdominal muscles are flabby, and you need to get back in shape. So you do not need to, you should not diet when you're breastfeeding or when you are recovering from a pregnancy. But exercise is something which you should do, not to lose weight, but to become strong and fit, to strengthen your core and to strengthen your overall muscles, overall body, so you can run behind the child when the child runs around. So next slide. Then you've had that child, you've gotten over that time, and again, work life balance, parenting, that can take not just one but maybe 10 webinars. Parenting is like a huge thing. But only one thing I want to say here is that self care will give you happiness. A happy person is going to be a happy parent, and a happy parent will have a happy child. You are trying to run around, you're doing everything, because every parent will try to do everything possible for the child. Yes, but sometimes you need to ask for help from your partner, from other people around you. Typically they say that it takes a village to raise a child, and it really does. uh, Today we have nuclear families, and it can get very overwhelming for the parents to take care of their child alone. But yes, you need to ask for help wherever, whenever needed. And you do need to do a lot of things for your child, but if you're doing them in a stressful manner, and you're doing, and while doing that, if you are yourself not getting the attention that you deserve, you're not going to be happy, and you're going to kind of not raise a happy child. So pay attention to yourself, be happy, and your child will be happy with you. um, and of course, when you talk about work life balance, remember, you are setting an example. So your child is silently watching you, what you're doing. If they see that, oh, my parent, my mother or my father has always been in office, he or she's going to grow up thinking that's normal. If
In
they
fact,
see
there are a
in
lot of research papers nowadays that are actually stating about how self care is so important during
so important,
parenting,
yes.
and a lot of people have been talking about this. So I think it's a great point where all of us should pay a lot of attention.
And it typically comes down to mommy guilt. I don't know, of course fathers definitely must be feeling something or the other. But typically mothers are like, oh no, I can't go out and I can't enjoy because my child is alone at home. It's okay, you're allowed to enjoy. It doesn't mean that, or even for fathers, it's okay if you go out with your friends. It doesn't mean that, oh, you've done a big crime and not by not being there for your child. Your child would rather be with a happy parent who has spent good time with his or her friends and come back, rather than having a cribbing person around. So always remember that self care is really, really important. Next slide. So there are a lot of other gynec issues also, which we may not be able to touch in detail today. But yes, one thing that I can talk about is having irregular periods or heavy periods. So if you have scanty periods, we say it's all right. If you have irregular periods wherein they're occurring very frequently, it's not all right. Heavy periods, not all right. So definitely you need to investigate, find out why that is happening. There could be hormonal problems. There could be a polyp, which is an overgrowth of your endometrium inside the uterus. There could be a fibroid causing more heavier bleeding. There could be endometriosis causing painful bleeding or irregular cycles. So all of these could be reasons of your irregular abnormal periods, which you need to find out and find a solution to. Very often I get ladies who say that I spoke to somebody, usko bhi utna hi hota hai bleeding, so I thought this is normal. Don't make your own judgments. You come and talk. See, at the most your doctor will say, oh, this is all right. She'll check you, say you are fine. But don't let it go just like that कि उसको भी होता है तो मुझे भी होता है, तो I thought it's normal. No, don't come to that conclusion. Let the
Self-diagnosis is the
yeah, don't and
worst
don't
form of sabotage.
and Google diagnosis is the worst. Self diagnosis is still better. It's like that. Google is the worst. So don't go on Google and find out what's correct and not correct for you. Next slide. Now coming towards this whole journey of PCOD ho gaya, parenting, and now we come to the point of, where you're talking about menopause, transition, perimenopause, menopause. If you see that graph over there, the first part is pre-menopause. Pre-menopause is typically all your reproductive years, which we have been speaking about for so long. The next part of your menstrual journey or reproductive journey is going to be your perimenopause, which is the time period before you actually get menopause. So menopause, typically Indian women get menopause at the age of 46 years on an average. The Western counterparts, they get their menopause around 51 years of age. So we get it a little earlier than the other Western or whatever, the American or the European women. So typically our menopause can be at on average at an age of 46 years, but your perimenopausal changes can begin before that. So your perimenopause can start around 4 years or even 10 years prior to you actually having your menopause. So you have to be aware that yes, even if you are maybe 40, yes, you may be having certain symptoms of perimenopause which may be leading to menopause. So it's a good thing to know what those symptoms are and to help yourself to treat them. So these symptoms of menopause, next slide. These symptoms of menopause that we have are because of low levels of estrogen. So that is because the ovarian follicles are finally getting over. There are no ovarian follicles, to secrete to be developed every month. And because of that, the estrogen which is secreted by these follicles goes down, and because of that, we have all of these symptoms of menopause. Menopause means you have no periods for 12 consecutive months. That is when we'll say you've reached menopause. Anything before that with symptoms or with irregular periods is what we call as perimenopause. So what are these symptoms of menopause? So estrogen, this hormone, works in everything right from your head to toe. So it works in your brain. So it gives you a good cognition. Next slide, Gopika. It improves your hair growth. It improves your skin. It works on your heart, works on your gut, works on your vagina, your bones, your urinary system. So all of these things are managed by your estrogen. So once your estrogen levels go down, you start having these symptoms of menopause. Um, so these are the symptoms that are menopausal symptoms, which include weight gain. They could have hot flashes, night sweats. There could be mood swings. There could be sudden tearfulness. There could be anxiety, anger. You can't sleep well. You get headaches. You get joint pains. All of these things can happen because of around your menopause. Next slide. Then coming to the point of what can we do for this, how can we tackle these symptoms? So first of all, for anything, you need to be aware. Just as we spoke for postpartum depression, you need to know that yes, this can happen because of menopause. So this can happen around the time of my menopause. 40, I'm 40 and my mother got menopause at 50. I can't have this now. No, maybe you can have it now because maybe it's typically dependent on heredity. Yes, your menopause, but what your mother ate, what that kind of lifestyle your mother had is not the same as what you have. So there could be some disparities, some changes, because of which you could get your menopause a little earlier than your mother, and you can have these symptoms of perimenopause or menopause a little earlier than the time that she did. So being aware of these symptoms is one thing which is important. Getting support. So unless and until your family members or your peers, your colleagues don't know about it, they're not going to be supportive because they don't know that all of this can happen. So very often, I get a patient who says, my family members don't understand. They say, "मैं तो ऐसे ही गुस्सा होती हो तुम." And then I say, why don't you get your husband? And the husband comes and they understand, they listen. "Kesha, all of this is legit. It can happen around menopause." And then suddenly the woman comes back and says, "Oh no, now my home picture has changed. Now everybody around me is really empathetic, really supportive of when I'm going through all of these problems and symptoms of menopause." So extending the awareness from the women in the family to the family members helps to get that support. And when I say family members, it's not just your spouse or your in-laws or your parents. It also means your children. And when I say children, it also means your son. Your sons also. In fact, they could, by giving you the support, you are kind of laying down a foundation for the future when they are going to be supportive when their wives suffer from these menopausal symptoms as well. So looking at these symptoms and these problems empathetically definitely helps to take care of, sometimes just one care, one gesture with care can kind of alleviate the lady's symptoms by maybe 20-30% even. So it's very very important to be compassionate about these symptoms when these ladies are going through
It's
when.
so beautiful how you connected the whole thing with family and ultimately made it a point where, it's a thing where women are actually grooming their sons to
Really
make
they are,
them
yeah.
grow up and, do the same care for their wives. It's just brilliant how you connected the dots.
And again, of course, you need to know when to seek help and especially when to seek professional help. So, anytime, like I said, you're having heavier periods, when your symptoms are very difficult for you to manage, when you're having your periods are too frequently occurring, when you stopped having periods, and now, after a year or so of your menopause, you again have some bleeding. That's a time when you should go and seek help from your gynecologist. Anytime you have bleeding after you've had intercourse, that's a good time to, I mean, important time to go and speak to your gynecologist to understand what is happening. Other times when we have some times, so I'll just, touch upon certain screening methods also. So when we talk about, so we spoke about certain things that we need to do before your pregnancy. So what do you need to do before, I mean, around this time? So what is a routine thing that you need to be, you need to take care of? So it's about two things typically. One is protection against breast cancer, protection against cervical cancer. Why just these two cancers? Because they are the commonest cancers among females in the world, and of course in India as well. So talking about, and ironically enough, these two cancers have screening methods which are very simple, and still they are the commonest cancers among females. So it's a good thing to be aware of these things and practice methods to prevent these cancers. So talking about breast cancer, three things. One thing is self breast examination done every month. You can do it around the seventh or eighth day of your cycle because that's a time when your breasts are the least lumpy. So you can identify any kind of problems around this time. So usually we advise it to be done maybe after a bath. You come and observe yourself in the mirror, keep both your hands on your waist and look at yourself in the mirror without your clothes on obviously, and see if there are any changes in your breasts, any size change, any skin changes, any changes around the nipple, any puckering that you notice, any kind of discharge that you see. Then feel the breasts with your opposite hands, with the flat of your hand, and feel if you can see any kind of lumps in your breasts. Feel both your breasts. Once you start doing this every month, you will get a feel of your own breast and understand in case there is some kind of problem, even a small one. Because the earlier you diagnose a problem, the earlier it is treated, and you can prevent that whole thing from progressing to cancer as well. Second thing, apart after self breast examination, is a clinical breast examination done once a year. Get the same thing done from a doctor. Third thing is a mammography. Now, mammography initially did not have any clear guidelines kab karna hai, because mammography in itself, people were scared because it is a procedure which involves X-rays, radiation. So, uh, getting exposed to that radiation every year was little scary. But today, with the kind of cases we are seeing, the increased number of cancers we are seeing, even oncologists, oncosurgeons are advising mammography to be done once a year or once every 3 years, depending on how your previous report is. So it's a procedure which has extremely low radiation, lesser than a typical X-ray also, and it's definitely safe to be done. These three things about breast cancer. Coming to cervical cancer. Cervical cancer is the cancer of the mouth of the uterus. Again, very simple to find out and diagnose and treat before it actually progresses to cancer. So it's been proven that cervical cancer is caused by a virus called the human papilloma virus, HPV. So it doesn't mean that today you have an infection and tomorrow you have the cancer. It takes around 10 to 20 years for the changes, for the infection to cause changes in the cells of your cervix and to actually go ahead and turn into cancer. So you have those 10 to 20 years in your hand to find out if there is any problem. So a pap smear, which is a gentle examination of the cells of your cervix, which a pap smear done once every 3 years, starting from the age of 30 years, is something which can catch all these changes in case they're happening inside your cervix. Since it's also caused by this virus HPV, you can also do a pap smear plus a HPV DNA testing. In case you do that, you need to do it every 5 years. It is a little uncomfortable, a pap smear, I agree, but doing it once in 3 to 5 years, it's definitely something that you can do, and it's going to save you a lot of trouble. So these are the two typical screening methods that you have for cancers. Apart from that, getting yourself screened for problems, I mean, your blood work done to understand where you are, because menopause or perimenopause is a time when you are most susceptible or prone to having metabolic problems, like high cholesterol, blood pressure, diabetes, and so on. So it's a good time to get yourself tested every yearly to understand where you are on the spectrum. It's a good thing to actually weigh yourself and find out what your BMI is, what your waist and hip measurement is, so you know where you stand on the scale and and you decide which side you want to go to. Next, I think we're done, right? Next, yeah. So yes, I think I give it over to Gopika to enlighten you, tell you about a bit of programs that we have at ELDA.
Thank you so much, Ameya, for sharing your insights. We know it was quite a webinar with several topics, but Ameya very seamlessly connected it all. So we really hope you enjoyed it. Before we go with the Q&A, I just wanted to briefly explain to you what we do at ELDA. So we are a women healthcare company, and we offer health education as well as personalized lifestyle solutions. So all our providers are extremely empathetic. Just the way Ameya spoke about, postpartum depression, very, very sensitive topics. The way all our providers handle it is extremely sensitive and non-judgmental. So they ensure that you're very comfortable sharing your concerns. So speaking about the exclusive sort of offers that we have in store for you, one is the ELDA wellness screening, which is typically like an introductory screening of sorts, wherein we give you access to an at-home diagnostic test, and then you are set up for a virtual gynecologist consultation. Now, the consultation is slightly different in the sense that first it starts with a detailed assessment of all your biomarkers, which they get from the blood test. And then post the assessment, the doctor understands what your concerns are, and she proposes lifestyle recommendations needed, right? Because that's the approach that we follow. And of course, medical interventions, if needed, are also proposed. So this is typically an introductory program to make you understand the ELDA approach and what our ideology is, basically, right? The other programs which are mentioned here are more long-term. So the ELDA Bounce Back program, we have this at 3 months, 6 months, and 12 months. So this is like a sustainable weight management program. Now, again, what I mean by sustainable is that we don't directly target the weight management. We try to understand what are the root causes leading to that weight gain, right? Which could be some examples that I've given here are pre-diabetes, thyroid, PCOS, etc. And then afterwards, we equip you with measures to for you to be able to independently handle those weight fluctuations. So that's how we look at it. It's a slow and steady process. So here also we first give you access to a diagnostic test at home. We One of our partners comes and collects a blood sample, and then you get a dedicated care manager who's like your support through this program. In fact, we have high repeat rates in our programs primarily because of our care managers, because they give you that much support. And so the care manager will set up again a gynecologist consultation for you so that the doctor assesses any pre-existing medical conditions are there or not. And then post that, you're introduced to our nutritionists, and they'll give you a personalized meal plan based on your blood tests. And of course, you have access to yoga, functional training on a weekly basis. You also have regular progress tracking calls with our health coach, who functions as your accountability partner. So if you have any barriers to your weight management journey, she'll always try to understand what are the ways with which you can overcome that, and she'll motivate you through the process, right? And then, last but not the least, we have our ELDA Unwind program, which is an emotional well being and mindfulness program. So, before you enroll into a monthly program, you always have the option to go for a weekly pack, wherein you have access to a virtual consultation with our therapist and 1 week of yoga for the mind to make you feel better, lighter, and de stressed. And of course, you have the same thing on a monthly basis where you get 4 therapist sessions and 1 month of yoga for the mind. So, if you're interested in any of these programs or would like to know more about what we do at ELDA, you can always WhatsApp me on this number that I've mentioned here, and you can reach out to us. So, thank you for listening in, and I think we can go to the Q&A.
Thank you so much, Dr. Ameya and Gopika. That was a really well constructed presentation for all of us. A lot of new learnings. Personally, I feel all I knew that my mom has menopause for so long, but today, after understanding the whole journey and how the human body functions, and what are the different stages involved in the menopause, yeah, I think I'm just so enlightened, and I can probably have more empathy driven conversations with my own mother. So thank you so much, doctor, for bringing out this topic today and enlightening all of us. It's been wonderful. To everyone on the chat section, please make a note of whatever Gopika mentioned. You can also check out the Elder Health website over there. You can reach out to them via LinkedIn, Instagram, Facebook, whatever is convenient for you. But please, please, please do make a use of this wonderful organization that we have here, and it's definitely a place you should look out for your well-being ahead. So thank you so much for this amazing session. Now we'll quickly jump onto the Q&A part. I'm going to quickly read out whatever questions we've had from our attendees. So we have Pratepa asking, can you tell us some quick, easy exercises for prenatal care, like during the pre-pregnancy stage? What are some exercises that one can do?
So pre-pregnancy exercise can be anything. If you have been exercising from before, you can just continue the same exercises. So you know in the early pregnancy stage, when you are actually pregnant in the early this thing, maybe jumping or climbing the stairs up and down, is nothing is going to happen to your pregnancy. So your pregnancy, the baby is embedded inside the endometrium, inside the uterus. So a little bit of extra exercise does not do anything, does not cause any problems for your pregnancy. So you can please continue whatever exercise you have been doing. Of course, if there are some issues wherein you've been advised to take rest, then you do need to take rest. Even in that case, you can do upper body exercises with your hands and all. That can be done even if you've been advised bed rest. Otherwise, a great exercise could be walking. I don't typically doesn't usually have any kind of contraindications. Even in pregnancy, I would say swimming is a very good exercise, because you are not taking your own body's weight. So it's good to that's a good exercise. If you can swim, you can go for swimming during your pregnancy. But initial pre-pregnancy time, please exercise whichever way you want. Nothing will happen.
We have Archana asking, do irregular periods alone be accounted for PCOD?
So no, like I said, it's typically two out of three things that have to be there. So you have to, there should be irregular periods, or I mean, two of the three things: irregular periods, sonography picture, or signs of male hormone excess, which is acne or hair problems. So two of these three being positive is only when you actually have PCOD.
Okay. Is it suggestible to have pineapple and papaya in the first 3 months of pregnancy?
So it's typically something that is people say that they should avoid. I mean, your parents, your mothers, and all will say you should avoid. When people ask me this question, I ask them that when did you have papaya the last time? So papaya is not like a very common or a favorite fruit among people. So okay, if they say don't eat papaya for first 3 months, it's okay, don't eat it. But having said that, raw papaya contains papain, which is problematic, could be problematic for the uterus because it causes uterine contractions. In Indian cuisine, we don't usually eat raw papaya. It's typically a part of Thai salads and all. So maybe we could avoid eating that. But otherwise, papaya, pineapple doesn't really cause any problem in pregnancy. But there are so many other fruits. So go for the other fruits because it has a very strong this thing in the family. You should not eat papaya. So if they're saying no, don't eat it. It's not like a big thing.
Lalita asks that she has abnormal pain while excretion from 1.5 years, after 6 months of the baby delivery. What could be a possible reason for this?
You need to get examined from a doctor because this could be this could be abnormal from 1.5 years. Yeah, so this there could be a problem which has happened. Something happened during your delivery which could be responsible for this, but it can be treated. So nothing to worry. But this is something that is better to be examined and treated.
All right. We have Rashmi saying that this month she had her regular periods, but again it started after 8 days, and then she had fever, weakness, and checkup done where she found out that platelet count was low. Then she was admitted to the hospital, but now she's okay. And she says she faces this issue sometimes where this bleeding is happening again. Why would you
So
suggest
there
this
could
happen?
be, yeah. So this there could she must have had some kind of a viral infection with platelets down. It could be, I mean, some of the viral infections cause fever and low platelets, and with this kind of a stress that the body is facing, there could be some abnormalities that you can notice in your periods. You might have to take some medications for this month, for this phase to pass away before you can start getting your normal periods. So this could be like a one-off thing because of the infection. So don't worry about it, but it will be, you may need to take some medication for it.
Shweta says that earlier before pregnancy she got periods in every 28 to 30 days, but after the baby is 1 year old now she gets periods after 11 months postpartum, and now there is no fixed date and it's irregular. Why does that happen?
So till the time you are breastfeeding, your periods can be irregular because the hormones during your breastfeeding uh, interfere with your cycle and don't let it. I mean, there could be irregularities because of that. So if you're breastfeeding, don't worry about that. Once you stop breastfeeding, that will be fine. And again, since we are talking about it, we recommend breastfeeding for at least 2 years after delivery. So don't stop breastfeeding for your period issue, or you can please continue breastfeeding. It will be fine. It will come back to normal once you stop.
Mahalakshmi says, what's the age when menopause needs to stop? My mother has fibroids, which is not bothering her, and menopause does not stop for her. She is 56 years old. Doctor suggested for scan and told mostly it would be like that she needs to remove the uterus. Do we need to take a second opinion, or can we wait for menopause to stop naturally?
So, in case her mother is having heavy bleeding, which is probably because of the fibroids, then it might be necessary for her to remove the uterus, because we cannot tell you when will you have menopause. 56, yes, you should be having a menopause, but that doesn't mean that you keep on bleeding till the time you have menopause. If the problem is because, if the bleeding is because of the fibroids, the answer is a surgery. If the bleeding is because of any hormonal change, the answer is hormonal medication. So depending on what the problem is, the doctor must have advised her what to do. and very difficult to comment without knowing the whole picture and the whole sonography and everything. But um, yeah, so if it's fibroids, then yes, you might need to remove the uterus. If it's not, I mean, when you say fibroid is not bothering her, if it's causing bleeding, or if the fibroid is very big, then you do need to remove it.
In that case, Mahalakshmi, I would suggest you take an appointment with Dr. Ameya once to
Yeah,
understand this better. Is it advised to start
yeah.
taking folic acid tablets months before pregnancy?
So folic acid is one vitamin which prevents neural tube defects in the baby, which means that the baby's spine when it is developing, so it prevents any problems in that development. So it's good to have folic acid before you get pregnant. So typically the neural tube of the baby is formed when you miss your periods. So if when you get pregnant after your ovulation and you miss your periods, right? So that's the time when actually that neural tube is getting formed. That's why we say have folic acid before you get pregnant, rather than starting it after you realize that you're pregnant. So good thing to start folic acid tablets a few months before you. Like you can start when you start planning a pregnancy.
We have a very interesting question where someone asks, how does menopause affect mental health? My mom is a patient of schizophrenia. Her age is 47. Kindly help with some tips.
Yeah, so estrogen plays a role in your mental health, in maintaining your mental health. And with menopause, it's extremely common for you to face symptoms of maybe mood swings or mind fog or anger, all of these issues. So in case she's already a patient of schizophrenia, she must be taking certain medications for that. You may need to tweak those medications a little bit when around her menopause. So some tips regarding women with women health and menopause, and mental health and menopause, sorry, would be that again, one is take care of yourself. Second is, if you find yourself that you find that you are getting angry more often, a very simple solution is to, that this situation has made you angry, you simply leave the room for that moment. Because very often patients come and tell me, I get angry on small things, and then I realize कि अरे इसके ऊपर I didn't need to get angry about. I'm like, why did I get angry about that? So sometimes, just to avoid those knee-jerk reactions, something has made you angry, just walk out of that room, go outside. Sitting there and counting 10 to 1 is sometimes gets really difficult to manage. Just walk out of that situation or that room, calm yourself down and come back. Simple solution. Second is some exercise. So exercise releases happy hormones called endorphins, which make you feel better mentally also, apart from giving you the physical benefits of exercise. So regular exercise helps. Similar things happen, similar endorphins are released when you're spending some time doing an activity that you like. Could be anything apart from watching TV, I would say, or screen or whatever. So anything could be, walking or exercising, reading, um, gardening, painting, drawing, whatever it is. All of these things, these hobbies will give you that mental peace, and it's good to do these hobbies, take up these hobbies at this time of your life.
Great. So I'll take the last question. We have Amreen from Zero Plast who says, I tested PCOD and TSH 0.01, but doctor said it is not possible to have both. Kindly guide me. Is this hypothyroidism?
Possible to have both. I didn't understand the question, but yeah, 0.01 thyroid could be, it's hypothyroidism. So maybe he must have started you on some thyroid medication. So thyroid abnormalities can cause irregular periods. So maybe that's what he meant when he said you can't have both. So in case you are having thyroid, in case you're having irregular periods, we typically check your thyroid levels. If they are abnormal, correcting those thyroid levels will correct your irregular periods. That doesn't mean you have PCOD.
Got it. I
But
think
that is hypothyroidism, not hyper.
okay.
Lower level of TSH.
Okay, I'll take one more question. We have Shanmuka asking, my mother's uterus walls are getting thin because she gets heavy bleeding and using medication, but it is not helping. Can you suggest anything, ma'am?
Uterus walls are getting thin. I don't understand the question, to be honest. But if she is getting heavy bleeding and using medication, one option is to change the type of medication she's getting, which the doctor can help you with. Second is, in case there are some times when medications cannot manage the heavy bleeding, wherein we have to go for a hysterectomy to remove the uterus. But this is a very broad answer. It may not. I mean, I have to see the reports to actually comment on that.
Wonderful. All right. Thank you so much. With that, we come to the end of the Q&A session and our today's webinar. It's been a wonderful, wonderful 1 hour with you, Doctor and Gopika. I think after this session, a lot of people who are actually not comfortable reading heavy textbooks have gotten a lot of information.
Again, it's something which is a good question. I'll just take one more. Does using menstrual cup have any consequences? The consequences of using a menstrual cup are A, you tend to forget you have periods. B, you can live a normal life when you're having periods. C, you are saving the environment by not polluting it with pads. D, you can swim when you have periods. What else can I speak of? E, you don't feel messy when you have periods. So ladies, please go ahead and use a menstrual cup. It's safe to use.
Amazing. Wow. I think that's my typical definition of a doctor. They never let you end the conversation. They are the last people to talk.
Yeah, I want to just comment on that because
it's another session though on menstrual cup.
But yeah, I think it's been superb having doctors speak about all of this to all of us, and so many questions got answered. I'm actually so happy to see the responses that we've had and the kind of questions that people have raised. And I think it was so well conducted by Doctor, very brilliantly constructed presentation and really apt information that was shared across today. And I think it's just amazing to have you and Elda Health support such an initiative. Amazing. Thank you so much, Doctor. And thank you again for your time. And we will look forward to having Dr. Ameya one time again with us to see whether we can have another session on something connected to this, since Doctor had a lot to mention about why we need more number of webinars. So I'm sure we can have Doctor come and speak to us again. Till then, thank you so much, everyone, for joining. And please stay tuned with Onsurity's Wellness Wednesdays. Follow us on LinkedIn. Please send your suggestions, comments on our posts, and let us know if you are looking forward to a specific session that you would like us to conduct for. Thank you so much, everyone, for joining me today.